Hey there. So, one of the things that families come to Speech Kids for is for something we call an informal developmental consultation. And what this is it's usually for very young children, so think 2.5 and under, where we're looking at all aspects of child development. And people are sometimes surprised when we do that. And so I'd like to tell you more about why we do that here, which is all of child development, particularly the earlier you are, so the closer you are to birth, all of your development is related. And so any little glitch or any little issue, or big issue for that matter, that's happening in development is happening across domains, even though people talk about sort of these different domains of development, right? So people talk about speech and language development. We talk about motor development and sensory development and social emotional development and cognitive development. So we like silo all of these out, but the fact of the matter is the younger your child, the less we can separate them. And so it's our job when kids are coming in for late talking or for some other reason, and lots of times because we specialize with young children, it is because a child isn't speaking yet. But lots of times in these informal consultations, we're finding that kids have had a history of digestive issues, constipation, diarrhea, picky eating is a big one, trouble with latch, torticollis, eczema. And now you're like, well, hang on a second. How could eczema possibly be related to speech and language difficulties? And the short answer is we don't actually know because there isn't a lot of research about it. But here's what I'm telling you, which is I've, number one, seen enough kids who have this profile where, and we'll just take eczema as an example, they've got this skin flare-up, right, inflammation, and then they're also late to talk. And again, we do not know why that is. There is not good science like double-blind studies, researching this issue. But what we can see is that there is a really good chance that one is impacting the other. So, right, inflammation, for example, whole body issue, immune system's on fire, right? Literally, sometimes I think that's how the kids feel. And so if brain is so busy regulating and fixing a problem and the immune system's all fired up, well, guess what? Talking is like, yeah, we'll get to that later, right? So again, I am not saying that there is good science on this, but I am saying this is what I have observed, is that these little kind of developmental issues go along with sometimes speech and language issues. And so when a kid comes into the practice we want to know, like, why isn't this child speaking yet? We want to look at other things that might be contributing, because that's going to inform who else we refer to. For example, maybe I'm going to refer somebody who comes in who's a late talker to a GI doctor, for example. Maybe I'm going to refer somebody who comes in who's a late talker to an occupational therapist, or somebody who can do some body readjusting and work on some sensory integration skills. So there's like a whole host of professionals that we refer to, and part of the reason why we ask questions about early feeding, about sleep, about diet and digestion is so that we can get a fuller picture, because it all relates back to speech and language at some level. And we have to sort of figure out, we have to be detectives and figure out what the threads are and which threads need to be pulled right now and which threads we're going to leave alone and see what happens. And so it's a process, but it involves sort of traveling down some avenues that don't immediately seem relevant and yet absolutely are, particularly in early childhood.